Hello friends, today I'll talk on pulmonary tuberculosis and the treatment of pulmonary tuberculosis. How you will know whether the patient is improving on anti-tubercular treatment or not. So there are a few points. You should know how you will judge the patient whether the patient is improving on anti-tubercular treatment or not. When the patient is put on anti-tubercular treatment, in the beginning, patient won't feel that much difference, like maybe for 15 to 20 days. After that, patient will definitely improve and patient will improve symptomatically. So to start with the symptoms, first of all, fever, patient will improve. These symptoms will definitely decrease and patient will not feel feverish and evening rise of temperature. He will not feel malaise. These symptoms will definitely improve. Cough will decrease in frequency and the expectoration also will diminish in quantity. The color of the expectoration will change. Usually at the beginning of the treatment, patient the expectoration will be purulent in color, but gradually patient will have mucoid expectoration. And regarding cough, another important thing is those patients who are already having some background of lung disease like bronchitis, bronchitis, or any type of other lung disease, or a smoker. Those patients will show less improvement and they will be continuously complaining of cough. And some patient with this type of disease, even after completion of anti-tubercular treatment, they complain about cough. That is because of their background, that lung disease. The lung disease already they are having, not because of pulmonary tuberculosis. And regarding expectoration, the amount of expectoration, the color will change and it will decrease the amount of expectoration also. Now come to appetite. This is a very good indicator. Patient will show good appetite after this many days, and patient will start having good food along with anti-tubercular treatment. So definitely there will be improvement. And because the appetite will improve and patient is on anti-tubercular treatment, then after a few days patient will show improvement in weight also. Weight is a good indicator of improvement on anti-tubercular treatment. That's why whenever we start a patient on anti-tubercular treatment, we see the weight first, body weight, and then this body weight usually we note down in the treatment card of the patient and patient identity card, so that when the patient come for follow-up, then we can see the body weight again and judge whether the patient is improving or not. This is very important, and I have seen many treatment card and patient identity card during my visit to different PHCs and DMC and many sub-centers, that they don't maintain that treatment card properly, they don't maintain the identity card properly. This is a misleading thing. They have to maintain this because this is a good indicator of improvement of patient, and moreover this is a good indicator of our health service, that whether we are up to the mark, we are doing good work. So patient body weight should be maintained and should be mentioned in treatment card and patient's identity card. And the next is patient's general condition. Patient will definitely improve and patient general weakness will reduce, and there will be a feeling of well-being. And some patients are there who spontaneously tell their doctor that they are improving. So that is one thing. Next is extrapulmonary tuberculosis. Up to this I have told about pulmonary tuberculosis. Now extrapulmonary tuberculosis. In case of extrapulmonary tuberculosis, if it is abdominal tuberculosis, abdominal complaints like abdominal upset and abdominal distension, this type of complaints will be less, and bowel movement, all these things will improve. In case of pleural effusion, patient usually complains of chest pain because the pleura is supplied by nerve, and when there is fluid inside the pleural cavity, that will be stretched and patient will feel chest pain. So chest pain will be reduced, patient will definitely improve in case of chest discomfort and all. Next is neurological tuberculosis. If patient conscious level is low or patient is semi-conscious, after the treatment patient might improve his conscious level, and other neurological thing patient will improve. And other extrapulmonary tuberculosis, yes, their improvement will be related to their organ system. So that's all about the improvement related to symptoms. Now two things left. One is sputum examination. Usually when we put the patient on antitubercular treatment, we do the sputum examination to establish mycobacterium tuberculosis in the sputum. We do sputum smear and examine under the microscope to see whether the bacilli is there. During the follow-up, when the patient comes every 2 months for follow-up, that time also we do sputum smear examination and look for bacilli, whether the bacilli is there. If patient is improving, then definitely the number of bacilli will be reduced, and sometimes some patient will show drastic improvement, showing that the sputum smear has turned negative. Previously it was positive, now after treatment it has turned negative. So that is one thing. And the last one is chest x-ray. Usually in setup like government setup or setup where other investigations are not available, our main aim will be sputum smear examination and chest x-ray PA view. In chest x-ray PA view also we look for improvement. If earlier there is consolidation or cavity, whether the consolidation has resolved, whether the cavity is not there or whether it is there. So we see the radiological improvement also. So these are the things we can judge a patient whether the patient is improving on antitubercular treatment or not. That's all, friends. Hope you have liked this video. If you have liked this video, please click the like button and subscribe our channel. Thank you for watching this video. Stay healthy.